When disaster strikes your neighborhood, how will emergency responders know what you and your neighbors need in order to recover? One method, the Community Assessment for Public Health Emergency Response, better known as CASPER, was developed by the Centers for Disease Control and Prevention, or CDC. In November 2012, Lake County Public Health, with assistance from the CDC and the California Department of Public Health, tested the CASPER method for assessing disaster preparedness of Lake County residents. The survey focused on how prepared Lake County residents are for emergencies, especially health aspects of disasters. It also asked about the community's experience with some unique features of Lake County, such as the venting of geothermal gases.
So I zeroed this out at the last one.
In addition to the survey activities, air quality experts tested the air for hydrogen sulfide and methane in the same neighborhoods. Although the survey process was an actual event, Lake County public health staff used the CASPER survey as an opportunity to conduct an emergency training exercise. Neighborhoods that were surveyed were selected in advance through a procedure defined by the CASPER method. 30 census blocks were identified. The goal was to get 7 households within each census block to take the survey for a grand total of 210 households within a short 48 hours. Results of the survey would take another day or two to complete. Participants included local, state, and federal public health professionals and public health and nursing students. Medical Reserve Corps and ham radio volunteers assisted with logistics. In all, approximately 60 people, many of them volunteers, contributed to the success of the CASPER survey. After registration and creation of photo ID cards, just-in-time training was conducted. Surveyors learned how to properly select households and administer the 20-minute questionnaire. Safety was the highest priority, and the chief of the Clear Lake Police Department provided the briefing.
I know for the surveyors yourself, you're going to have placards for it, so that's great. That way if we get calls, hey, we have a suspicious car in this area, we already know where it's there, and we can tell the public what's going on.
Volunteers were sworn in as disaster service workers.
Do solemnly swear or affirm
that I will support and defend the Constitution of the United States,
the Constitution of the United States.
And equipment was assigned. The surveyors were supplied with backpacks, clipboards, walkie-talkies, survey forms, traffic cones, car signage, rain ponchos, and more. Then the surveyors hit the streets. 14 survey teams, including a number of bilingual Spanish-speaking surveyors, were grouped into 5 units to assist with safety monitoring and radio communications. Several field stations were set up to provide nearby locations for rest and first aid. Local ham radio operators throughout the community monitored the radio channels and assisted with communications as needed. Pre-identified neighborhood contacts provided surveyors with quick access to gated communities.
Oh, you did too? Okay. They say they did too. I didn't realize that they had done too.
Back at headquarters, a unified command structure comprised of local, state, and federal representatives carefully monitored the progress of the surveyors. Epidemiology experts entered data from completed questionnaires as they came in. The goal of all of this activity was to complete the survey in 48 hours and quickly generate results. The threat of an incoming storm made that deadline definite. After a little more than 2 full days of activity, equipment was checked in. Volunteers, all safe and accounted for, headed home, and the state and federal epidemiologists began the data analysis. While the survey's results will be the subject of discussion for a long time, the process of conducting the survey taught valuable lessons that could be used immediately. Local, state, and federal public health agencies can successfully collaborate to plan and coordinate field activities, each agency contributing its own special expertise. strict adherence to the principles in the National Incident Management System, or NIMS, is a must to avoid confusion and maximize efficiencies. NIMS is the standardized organizational framework used to coordinate all levels of disaster response. When conducted properly, the CASPER method assures that neighborhoods are fully and objectively assessed, including houses that initially don't appear to be occupied. The CASPER method may not always anticipate local neighborhood characteristics, such as vacation homes, impassable country roads, and gated communities. Flexibility is important, including having a plan to get an adequate sample in areas that don't yield the expected number of interviews. Local planning and coordination with neighborhood contacts, including tribal leaders, before a CASPER survey will contribute to its success. Strong logistical support for surveyors helps make the process safe and efficient, and using local knowledge of neighborhoods reduces the stress of being in the field. Bagged lunches allowed surveyors to stay nourished without having to spend valuable daylight looking for a place to eat, since safety considerations precluded evening interviews. Having detailed safety and communication plans that consider local hazards and conditions is critical. For example, how will surveyors handle cellular telephone dead zones, inclement weather, and stray dogs? Solutions can sometimes be quite simple, like adding dog treats to the surveyor's packs. Keeping track of people and equipment is a challenge. Assigning more than 3 personnel to help with logistics and more than 2 for operations may be necessary. Preparing the community to participate in a CASPER survey before disaster strikes will probably speed up the recovery process if a future CASPER survey is needed following an actual disaster. In this case, the media helped alert residents to the survey before volunteers hit the streets. Lake County's experience with the CASPER method was both challenging and rewarding. Analysis of the survey data will guide future public health and community-level planning. Participation of the many agencies, neighborhood contacts, and volunteers was an important building block in Lake County's ability to respond and recover from future disasters. And finally, along with all of the hard work, surveyors took in the beautiful landscape of the community that their efforts served to protect. Thanks to all for helping Lake County's neighborhoods take an important step toward being better prepared.